Hi. Hello. Good afternoon. Can you guys hear me? We already have 5 people. I can see that. Hello. Is everything clear? Who do we have? Let's see the participants. Yep. Hello. We'll be going live at 6 sharp. Hello, everybody. Hi. Am I audible? Can you all hear me? Is everything okay? Looks good. Yeah. Just few more seconds to go. Yeah. 6. Yeah. Hello. Hi. Good afternoon, everybody. Welcome to DentalDost YouTube channel. I'm Dr. Asawari Savant, dentist, public health specialist, as well as brown belt in karate. And today we will be talking about martial arts and oral care injuries. What to do if you are an athlete, if you are a sports person, if you are into activities and sports and like that, and if you come across any oral care injury, what precautions to take and how to care. Okay, so let's get started. Today, the first thing that we come across a lot, regardless you are a sports person or not, is tooth pain. So, if you're a sports enthusiast, you tend to consume lots of sports drinks, sugary drinks, or extra supplements to boost your energy levels. That can cause you more prone to tooth decay and dental caries. We see in our patients all the time that people who consume sports drinks and protein shakes and like that are more prone to having sugary intake, are more prone to having oral caries. To care for that, we advise them to rinse their mouth with plain water to avoid retention of the sugar in their oral cavity. So, this way, it decreases the chances of dental caries. So, that is what you can do if you are someone who's consuming protein shakes or sugary drinks or energy drinks, or the things that are common these days, BCCA and those sorts of stuff. You just make sure to rinse your mouth after you consume them so as to avoid unwanted dental caries. So after this, the next we will talk about are tooth fractures. So if you are doing sports or martial arts for that matter, today we're focusing on martial arts and sports. So what can happen is, due to a strong blow or a fall or an accidental injury on your face or on your teeth, your tooth can fracture. It could be a partial chip or a major chip, or it could be just that the front layer of your enamel has worn out. So if on the tooth, suppose if just the front layer of your enamel has worn off because of grinding or pressure or force or anything like that, you may feel sensitivity and you may feel extra hot or cold whenever you drink or eat something like that. What you can do is consult with your dentist. It could be possible that your enamel has worn off due to stress, and that could be done with simple procedures at the dental clinic. If your tooth has chipped off, if your tooth has got fracture or something, if the fracture is just partially, such as see in this blue one, if it is a partial slight chipping of tooth, it could be fixed by simple filling at dental office. If it is a major chip, that is major chunk of your tooth has fallen out, such as this red one, 1/3 of the tooth has chipped off, there are chances that you would need to go for a root canal treatment for that matter. If you experience bleeding from the chip, or if the tooth turns darker in color or redder or something like that, or if you experience intense pain around that chip area, there are chances the pulp has been exposed. So just consult your dentist. They would probably advise you with a root canal treatment. So after that, we would talk about if you are facing any bleeding from your tooth. Suppose you were doing a physical activity, or you were lifting weights, doing karate, jiu-jitsu, or something like that. You've fallen on your tooth, front face down, and you feel bleeding from your tooth area, not your gums, but if it is from your tooth. There are chances. Do not panic. Consult your dentist or call our free dental helpline. It would be linked down below. There are chances that infections may occur in this, so do not try to do any home remedies by yourself. Consult your dentist or visit your dentist as soon as possible. If you have a tendency of putting a lot of stress on your mouth while lifting weights, while doing pressure sports such as jiu-jitsu or taekwondo or anything like that, if you know that you apply a lot of clenching pressure, which is in your mouth, you bite really hard, or while lifting weights or pulling them up or something, or you clench really hard like this. It could be anytime doing while doing pressure activities, or it could be also while you're sleeping if it is your subconscious habit because of stress. This could be because you're stressing a lot while doing that activity, and this could lead to attrition of your teeth. Attrition is the erosion of the outer layer of your teeth at the edges due to excessive force or grinding pressure. So what can you do is you should be careful not to do that. If you know you are subconsciously doing it, try to focus on your breathing and not exerting excessive pressure on your jaw or your teeth. And if you still face these problems, try to get a mouth guard while working out or doing activities, anything like that. If you are facing these things while you are sleeping, try to wear the night guard to sleep. This would help avoid unwanted problems of attrition or things like that. So you could also feel sensitivity if you are doing these things. Just consult your dentist or call our dental helpline. We'll be happy to guide you with the treatment and everything. So because of this excessive pressure, you are exerting not only pressure on your teeth but also on your jaw. The jaw joint that you have, this is called temporomandibular joint, which connects your lower jaw with your face. This could exert excessive pressure on your joints as well. So your jaw might you might experience pain on your jaw or your joint. Try seeking immediate help from your dentist. They would give you proper medications, as well as they would recommend you jaw exercises to relax your muscles and help ease the pain. If you do not know any dentist, call our dental helpline. It would be linked in the description box down below. Other than the pain and then tooth pain and jaw pain, what other things you may face while you are doing physical fitness activities or any sports or athletic activities could be mandible fracture. Fracture of the mandible, that is your lower jaw, isn't as common as tooth fracture. Tooth fracture is more common, but if you fall your face down on the ground while practicing, or if you get hit or get injured some way, your jaw could get fractured. You should go to visit a hospital or a dental clinic immediately and not delay. This is an emergency situation. If you are feeling any sudden pain in your jaw joint, this could be that your TMJ has dislocated. The jaw has moved from its place. If you feel extreme pain while opening or closing your mouth, this could be due to the stress of clenching your teeth, or it could also be due to sudden blow that your joint has dislocated. Sometimes it can also happen that your jaw, you are not able to close your jaw properly. It stays open. This is called a locked jaw, where the jaw gets locked in this open position like this. This case needs immediate attention from dentist, you should visit your dentist as soon as possible. If you do not have one, please feel free to call our free dental helpline, which would be linked down below. After this, what can we discuss is, if you're an athlete or a sports person or anything like that, you could have a few things. If you get hit on your face or your jaw from the front, either one of your tooth, for example, this is your tooth, and you get hit here, one of your tooth could get pushed in, that is inside, or could get pushed out. If it gets pushed in, it is called intrusive luxation. Sometimes a sudden hit or a blow can get the tooth pushed inside the jawbone, that is your gums. If it is a minor hit, intrusion, if the tooth has gone in just slightly 1 or 2 mm, the dentist would wait for it to come out spontaneously or automatically on its own. If the tooth has pushed in quite a bit, more than 2 mm or so, orthodontic help would be required, and the orthodontist would use the wires and everything to pull the teeth out in its proper position. If you got hit and somehow the tooth slightly came out or is moving now, this is called extrusive luxation, wherein the teeth would move. You could experience mild bleeding, and could also you may also feel the tooth is loose or it appears longer than normal. This could happen, and what dentists would do is they would splint the teeth with wires and stabilize it in its place back. So do consult your dentist in situations like this. Please do not delay. So coming on to the next topic, which is if your tooth has come out with its root. We experience these in athletes, people who do sports, or people who are into physical activities, or even in children a lot. If they fall from their face down, sometimes the whole tooth may come out from its root. For example, if this is your oral cavity, your tooth may completely come out like this. This is called avulsion of tooth. When the tooth comes out with its root and falls off, this is an emergency situation, and you need to visit a dental clinic within 45 minutes of the tooth coming out. How can you take the tooth with you? Please take the tooth with you. Do not carry it with your bare hands. Make sure to keep the tooth in either saline solution, that is pure water, or if you do not have saline solution on hand, you could also keep it in a container with your saliva in it. If you cannot do that, if it's bleeding a lot, you can keep it in milk, carry it in milk with you. That also works. If you do not even have that, tap water also works. Carry the tooth with the root with you to the dentist within 45 minutes of its coming out, and the dentist would be able to place it back in your socket if it is not infected, or if it is not bleeding excessively. If it is infected somehow, broken somehow, or if the socket is bleeding a lot, there are less chances of the dentist being able to fix it back. If it is not the case, he would be able to fix the same tooth back. If it is somehow more than 45 minutes and you got delayed, still try to reach your dentist as soon as possible. If it is more than 2 days that your tooth has come out, there are less chances that the dentist would be able to fix the same thing, because the cavity and your gum and everything changes. So for that case, they would then recommend you to either go for an implant or an artificial prosthesis of some sort. And another thing after this we would discuss is pink tooth. So what happens is when you got hit, sometimes the tooth doesn't chip, doesn't break or anything like that, but but it bleeds internally, which may result in the tooth turning pink in some time, over a period of time. This is called pink tooth. What happens is there is inner root canal which started bleeding. That's why, because of the blood, it appears pink or dark in color, even. And this would probably need root canal treatment. Um, if you have other things while doing physical activities related to oral injuries, such as cuts or lacerations or bruises or anything like that, make sure to clean the wound first with clean water, and apply use warm water saline rinses if it is internally, or if it's externally you can go for cold packs, and visit the dentist as soon as possible, or an emergency doctor. When you visit the dentist after such things, make sure to ask the dentist to check for any ulcers that might have happened accidentally. He would be able to recommend you the right gels and medications to apply 2 times a day. Other things that could happen are lip bleeding or loss of consciousness. Please take proper precautions for those things. Clean the wound properly and apply cold pack. And do visit your doctor or dentist as soon as possible. Some of the preventive measures that you can use to avoid such injuries, avoid getting blows on your mouth or accidental chips or fractures, is using proper mouth guard. Make sure to talk to your dentist about getting a proper mouth guard that is according to the size of your jaw cavity, and use it while doing strenuous exercises or martial arts, or while lifting weights or doing any sorts of sports. You should also invest in proper headgear to avoid unwanted injuries. Okay, so we have a lot of questions coming in. Let's jump on to questions. How much time do we have? We have about 15 minutes. That's good. The first question that I can see is, my daughter's front tooth is mobile since the time she fell. What to do? Okay, so if you can see that your daughter's front tooth is mobile because of her fall, do visit the dentist as soon as possible. It might have happened that your daughter must have got extrusive luxation, which is the tooth got pushed out a little bit because of the fall. What the dentist would do is use wires and splinting to set the tooth back into the oral cavity to fix it at its place. It also depends on the age of your child. If your daughter is young, in her teens or below, the tooth would be able to set back into its place in less amount of time. But if she is more than puberty age or something like that, if she's a full-blown adult, the splinting process could take more than a few weeks to set the tooth in place, but it sure is treatable. The next question that I can see is, what can I do if half of my front teeth is broken? Yeah, so as I discussed, if half of your front teeth or more than 1/3 of your front teeth is broken, such as the one we can see in this red one, a lot of portion of your front teeth is broken, you should visit your dentist as soon as possible. The chance more chances is that the dentist would recommend you a root canal treatment depending on your case, and you could also go for aesthetic treatments after that to cover up the surrounding areas or make it uniform, such as composite fillings or tooth buildup or any of those procedures. Your dentist would be able to guide you best according to your case. If you do not have a dentist, please feel free to call our free helpline, which would be linked in the description box down below. Do we have any more questions? Yeah, we have another question, which is please tell us more about mouth guard. Yeah, that's a really good question. So, if you have a habit of grinding your teeth, clenching your teeth, grinding is like this, clenching is like this, biting really hard. If you have any of these activities while you are sleeping, while you are focused in your work, or while you are doing any activities such as lifting weights, performing martial arts, doing any sort of sports, running, anything like that, if you observe yourself doing any of these two movements a lot, which is causing you pressure or pain, it is best to invest in a mouth guard. What is it? What it is a tray used to place in your oral cavity, which covers your upper and lower teeth, which you can wear even while sleeping or doing any of these activities, so as to avoid unwanted stress on your oral cavity and your teeth. You can talk to your dentist. He would be able to tell you best, and also he would be able to provide you with a size of the mouth guard according to the size of your jaw. The next question that we can see is, how would I know if I have grinding? That is a really good question. How would you know if you grind your teeth? Many people do it subconsciously. They are not aware that they are doing it. But if you feel that your oral cavity or your jaw, especially around your mandible, that is your lower jaw, you experience pain over here frequently. The pain is radiating somewhere, and you don't know that it is not because of any dental cavity or anything like that. It could be that you are applying pressure. Try to notice that while you are doing these focused activities. Some people do it while brainstorming, working on computers. Some people do it while lifting weights, while performing martial arts. Some people do it at night unconsciously. If you experience that, if you just stop and notice at those times if you are doing anything like that, and if you are, try to invest in a mouth guard. Or if you cannot and you want something to help you immediately, just stop everything and focus on your breathing. Do slow breathing. It will help you ease your stresses that you put on your face, and then continue with your activity. Especially while lifting weights, if you are doing it, try to focus on your breathing more and not on applying pressure through your jaw. Yeah, I got another question. How much time do we have? We have 10 minutes. Good. Next question is root canal treatment painful? No, it is not painful at all. Yeah, the dentist would mostly give you local anesthetics, which would not, which would make the area numb, and throughout the treatment, it would stay. The local anesthetic would work. You would not experience pain of any sort. So that is a complete pain-free procedure. If you need one, do call our free dental helpline. We would take your dental history and would be able to guide you with the best treatment. And the next question that I can see is, how long shall I wear the mouth guard? Your dentist would be able to advise you best with it depending on your needs, but you can wear the mouth guard whenever you are doing these activities or whenever you're going to sleep if you are putting enough pressure. Another question is, can you let me know if I grind remotely without visiting a dentist? Okay, so you want to know if you have the habit of grinding without needing to visit a dentist? Yes, that is possible. Whenever you're doing any sort of focused work, you're working on some sort of project, you're brainstorming, or you're doing any sort of physical activity or any activity which requires a lot of pressure and focus from your side. Just stop and notice if you are doing that at that time and if your jaw is hurting. If that is the case, then probably yes, you are putting excessive pressure. If you are grinding the teeth at night subconsciously, you can also see the edges of your tooth, that is over here, the edges of your tops and bottoms of your tooth are slightly eroded, slightly worn off all throughout. That is a clear sign that you may be grinding your teeth subconsciously or consciously. Do visit your dentist to know more about it and to seek treatment. The next question that I see is how would I know if I need a root canal? That is a very good question. How would you know if it is a basic caries that needs filling or if you need a root canal? The first sign that we say to our patients is if you are experiencing pain while you are in supine position, that is while you are sleeping or you're lying down. If you are having pain in your teeth during when you are lying down, that means you have pain in the pulp, which would mostly require a root canal treatment. If you are if it is just simple dental caries not exposed to the pulp, if it just requires filling, you won't experience pain while lying down. It would be just when you are upright or when you are exposed to anything sweet or sugary or anything like that. The next question is it bad if we have slightly broken edge of tooth? No, it is not bad. I feel beauty comes from within. So however you look is good. But if you want to make your teeth more aesthetically pleasing, you can go for treatments for slightly broken tooth. It is a very simple procedure and can be carried out with simple composite fillings or any other or treatment depending on your case, which the dentist recommend. So you can go for that. That is that. What time do we have? 5 minutes. Let me just wrap up. So we discussed today that what all things you can face if you are an athlete, if you do stress bearing activities such as lifting weights or taekwondo or judo or karate. I know this because I've been a karate player myself, so I also used to put so much pressure before knowing these things. So now after this video, I hope you would know what all precautions to take and how to deal with all these situations of tooth chipping off or having broken teeth or applying pressure or anything like that. We have a few more questions coming in. Let me just quickly answer those. Do your product provide dental treatment through app? Yeah, we have. I'm just coming on to it. Let me tell you what DentalDost is. DentalDost is a dental tech company, and we have India's first ever dental helpline, one which is completely free, available 24/7, and connects patients to directly our super qualified dental experts. We have our newly launched app for oral diagnosis now in the Play Store as well. Everything would be linked in the description box down below, so you can click on it and get it in your phone instantly. It would be a dentist on your fingertips. With this helpline and app, patients can get connected, can get instant consultations along with diagnosis and solutions for all their oral issues. Please feel free to call the helpline number any time of the day, 24/7, for free dental consultations from our dental experts. We have a large network of qualified DentalDost approved dentists all around Pune. If you want treatment, who give treatments at reasonable prices and are located closest to your location. Do we have any more questions coming in? Let me just quickly check. Yeah, thank you. Yeah, thank you everybody for patiently listening to me for 30 minutes straight. I hope you gain some valuable information about oral tips from this video, which you will be able to use in times of emergencies. Please do give it a like if you found it helpful and share with any of your sports or athlete friend that you know might benefit from this. Don't forget to subscribe to the channel and hit that notification bell for upcoming dental related content, and I'll see you guys next time. Bye bye. Have a great weekend.